Hi, my name is Kristen and I'm a registered physiotherapist. Welcome to this foam rolling movement practice for the upper body. We'll be doing some foam rolling today with a soft foam roll, a foam roll that has a little bit of give when you bend it and when you squeeze it. The softer foam roll is much better at getting into loosening up muscle stiffness and helping to rehydrate the muscles and the connective tissue, the fascia. You can do your foam rolling against bare skin or snug-fitting clothing. You want to take your time, keep breathing throughout the practice, and take a break at any time you need to. You're not to be pushing into pain. So we'll be doing the upper body, starting with the upper back, working our way to the top of the head. If you come down onto your foam roll, placing your upper back against the roll, support the head with the hands. Elbows are closer together, eyes are on your knees. And then you can just lift up your hips and start to roll a small section along your back. Breathing in and out. You want to try to make 5 or 6 passes. Moving slowly and smoothly and just noticing any areas that feel particularly tight or a little restricted. If you like, you can land on one of those areas and just move around very slightly, arching back or bending side to side. Shift the roll maybe a little bit higher and work another section of your upper back. Supporting the head, keeping the back rounded, eyes are straight ahead on your knees. Just using your legs to lever gently. Now we've worked the upper back in a couple of sections. Again, you can look for any areas that you need some extra attention. Maybe do a little side bend, very small. Arching back 1 or 2 segments, very small. And finish with 1 or 2 more passes. Now we'll work the muscles in around the back of the shoulder blades. So find the roll kind of at the bottom of your shoulder blades, the tip, the pointed part of that triangular bone. If you lift up one elbow, so I'm going to reach my right elbow a little bit forward, so I shift a little bit, just slightly, onto the inside edge of my right shoulder blade. And I'm going to work that roll up and down the inside edge of my right shoulder blade. A couple of passes, maybe getting smaller, narrowing in on any areas of tension. Again, this soft foam roll helps to get fluids and lymphatics into those muscles to release some tension. Good job. Letting that come down, we're going to move into the back of the shoulder. So if you turn to your side, letting your arm rest along the length of the roll. Let the elbow drop down, let your head rest in your hand, and then using your body with a side bend and a little bit of a crunch here, you can work the back of the shoulder. A few passes, maybe getting a little bit smaller or nudging into an area that feels like it needs a bit of extra work. Take your time, breathing in and out. Good job. Now to get the outer edge of the shoulder blade, I'm going to just open my leg a little bit and turn my elbow up so that I get in around the outer edge of the shoulder blade. That outside edge. I'm just using my legs a little bit to push myself up and down. And the space that you're covering is just a couple of inches. Good, edging into that area if you need to. If you find a spot you want to pause on it, you can do that. You can move the muscle against the compression point to help it release a little bit. Pausing there, and now we'll move into our lats and on along the side. So let your arm come above the roll, maybe adjusting it slightly, and doing that side bend again. That arm that's on the roll, just be straight and slide. If you need a bit of support for your head, you can use your top hand. And again, I'm trying to move through a side bend to get that space underneath the roll. Again, 5, 6 passes, not pushing into pain, moving nice and slow with calm breathing. Good job. Pausing there, coming down. Now we'll do the outer part of the shoulder. So having the roll land just at that divot at the side of your upper arm. Elbows tucked into your side, letting the arm press into here. And if this is too much pressure for you, then you can pause and maybe wait on this one, or do this against the wall or with a smaller, softer ball. I'm going to do a side bend again. Letting that elbow stay tucked close to my side. Rolling that outer part of my shoulder. Pushing the roller up and pulling the roller down. Making any adjustments if it starts to slide away from you. Good job. And again, you can hold a pressure point and you can move the hand to get in there a little bit more if you like. Or if you found it too difficult to move your body with the rolling, this is a nice option. Just pin the area and do a little bit of moving the muscle. Okay, coming down, letting the head rest against the roll. Finding that space just behind your ear, the base of your skull. And just working around in some little circles. Imagine you had Pinocchio's nose and you're drawing some circles with that long pencil nose. Breathing in and out each circle, taking your time and going in both directions. Good job. You can lie a bit halfway towards your back, opening up that top leg. Bringing the roll a little bit more towards the center, but not quite on the right, on the center. We're working our way there. Doing a little bit of rolling back and forth along that right side of the base of your skull. And if there's a spot you want to do some circles in, work that out a little bit more. Okay, pausing there, and then we'll go over onto the other side. Finding the tip of your shoulder blade. I'm going to be going for my left shoulder blade now. Head is supported in hands. Pushing my right elbow up slightly, so it ever so slightly tips towards my left side and makes my left shoulder blade a bit more prominent. And then I'm rolling the roll up and down that border on the inside of my left shoulder blade. Really focusing on that bottom spot right around that corner, the tip of the shoulder blade, the tip of that triangular bone. Again, 5 or 6 passes, moving nice and slow, or maybe just pausing on an area that needs a little bit more attention. Now we'll move completely to our sides, turning over onto your side, making any adjustments here, letting the arm reach out the length of the roll, drop the elbow down. So the back side of your shoulder is in contact with the roll, letting your head be supported by your bottom hand, and start to side bend to allow that roll to move up and down that back side of your shoulder. Making any adjustments necessary. If you need to, the roll slips away, just find it where it wants to be, where you want to place it. Working into some tender areas, but not pushing into pain. Good job. If we turn up slightly, we'll get the outer part of the shoulder blade. Maybe adjusting the roll if you need to find that space. And then you can let the arm go over top, placing it around the side of the ribs and just underneath the shoulder blade, supporting your head with your top arm if you like. Still side bending, maybe curling in a little bit, and straightening out a little bit, moving that roll underneath the arm. Now on a harder foam roll, this might be exquisitely tender and unable to do it. The softer foam roll is much better at getting into the tissue and allowing that fluid, that lymphatics and circulation to get into those muscles and fascia. Still get a really good outcome without having to force yourself into an uncomfortable place. Good job. Now we'll bring the arm to your side, tucking your elbow into your side, finding the space at the kind of divot point, at the bottom of the deltoid muscle, elbows by your side, and again, still doing some side bending, working into that side. Now, you might find that your neck gets tired supporting it itself. You may need to just take a little bit of a rest in between these moves, and that's fine, until your neck feels like it's gotten a little bit more strength or endurance to make it through. Good job. And again, if you want to hold pressure there, you can move the arm in and out. Rotating the shoulder slightly as you pin that spot. Good job. Letting our head rest now, letting it come down onto the roll. Find that place just behind your ear. So you're lying on your side, head is either straight ahead or slightly tipped up, and starting to do some circles on that spot. Again, imagine you had Pinocchio's nose, circling all around. And making sure you go nice and slow, breathing taking a breath for each circle, and going in both directions. Good job. Going into a little bit more towards the back. Getting your hair out of the way. Kind of in a half side lying place. Working across the base of the skull. From your ear to the center. Pausing on any spots and circling around into them. You might find that it's really hard to make your circles at first, but over practice, you'll get a little bit more coordinated. And actually that coordination that you build, that's motor control, that'll be really good to support your neck. Okay, moving on towards your back. Place the roll right in the center, the base of your skull. Let's work that a little bit more. You can go all the way from right to left. And you can try a little bit of that infinity figure 8, circling from side to side. And then just pause in the middle. Taking a full breath in, a full breath out, relaxing any tension through the back of your neck and shoulders. Coming off the roll. And it's always a good idea to just check with your alignment, your posture, or even notice your amount of movement you might have in a neck turn before, after, or a shoulder raise before and after your practice, so that you can see what kind of results you're getting and make adjustments as necessary. Thanks very much for joining me.